Thank you all for joining us for today's COVID-19 briefing. It is a good day in Newfoundland and Labrador, the eve of reopening to the rest of Canada. I know some people are nervous at home about that, but we have hit our milestones that we set in place. 80% by the end of day today or tomorrow should be vaccinated with 1 dose, and hopefully 20% with 2. These are incredible numbers and ones we should all be proud of. You should all be proud of at home. I think there's 466,000 doses had been administered in this province. And if we look back to where we were last year, certainly that would seem like an exceptional dream. But it is a reality, and the reality that many of you will experience tomorrow and in the oncoming weeks is reuniting with your loved ones. And we know you will do it safely and responsibly, and we want to thank you for your sacrifice and enjoy the warm embrace of loved ones as they return home. With that, I'll turn it over to Dr. Fitzgerald for an update on today's numbers.
Thank you, Premier. Good afternoon, everyone. Thanks for joining us here today. Since media advisory yesterday, we have 1 new confirmed case of COVID-19 in our province. The individual is between the age of 20 and 39, and the case is related to travel. The total number of cases in our province is now 1,386. There has been 1 new recovery since yesterday in the Labrador-Grenville Health region, leaving 5 active cases in the province. There is no one hospitalized as a result of COVID-19, and a total of 160,076 people have been tested to date. Tomorrow, the province will officially enter step 1 of the reopening plan. It's a big step, one that many people have been looking forward to, both inside and outside the province. Effective 12:01 a.m. tomorrow morning, non-essential travel will be permitted for the first time since May 4th, 2020. Our new travel form is now live, and anyone traveling to the province must complete the new form online. This can only be done within 72 hours of travel, as anyone partially vaccinated must upload their negative pre-arrival test within this time frame. It is important to remember that this new form is not an approval or a denial of travel. All travelers are permitted to enter the province. You do not need to have the travel form completed in order to proceed with making your travel plans, but it must be completed before you arrive in the province. The new travel form is simply the mechanism for anyone arriving in the province to declare their vaccination status and determine their self-isolation and testing requirements. Anyone who is already in the province and is either fully or partially vaccinated may transition to the new rules tomorrow. To do so, they must complete the travel form, noting an arrival date of July 1st, and upload their proof of vaccination. Fully vaccinated travelers are then able to leave self-isolation, and partially vaccinated individuals will receive instructions on how to book their test and must continue to self-isolate until they receive the negative test. We ask travelers to complete the form in advance of their arrival and not to wait until they reach their point of entry. Due to privacy requirements, border officials cannot view or accept any paper documentation regarding vaccination or test results, and therefore cannot assist any travelers in completing the form. If a traveler arrives without the form completed, they will need to self-isolate until they are contacted by a public health official and we are able to verify their proof of vaccination and pre-arrival test results, if applicable. Please do not contact 811 for help with the travel form, as they are unable to assist travelers in completing the form or accept proof of vaccination. For anyone who has been fully vaccinated, you will only need to complete the travel form once, and you can use the same reference number each time you return to Newfoundland and Labrador. This will help streamline the process, especially for those who travel to the province frequently, such as rotational workers. Effective tomorrow, we are also eliminating the designation of outbreak sites in Canada, meaning all domestic rotational workers will be treated the same. In addition to changes in travel, Step 1 includes a further easing of restrictions within the province. For formal gatherings organized by a business or organization, up to 250 people are permitted for outdoor gatherings with physical distancing. And provided physical distancing can be maintained, up to 200 people are permitted for indoor gatherings or 75% capacity, whichever is less. Larger venues can have separated cohorts with physical distancing. Funeral home visitation is now permitted for up to 25 people at a time, and dancing is permitted at weddings but still prohibited at bars and lounges. For informal gatherings, up to 50 people are permitted outdoors, and indoor personal gatherings remain limited to a household and their steady 20. Wakes held outside of a funeral home or place of worship are permitted in accordance with the limits for personal gatherings. For businesses, there are no capacity restrictions for retail stores as long as physical distancing can be maintained between patrons. Restaurants and lounges can open at 75% capacity with physical distancing maintained between patrons seated at adjacent tables, and self-serve buffets remain prohibited at this time. If we see sustained low case counts and meet our provincial vaccination targets, we can move to step 2 as soon as August 15th, when restrictions will ease further. As of Monday, we have 79% of the eligible population vaccinated with 1 dose and 17% vaccinated with 2 doses. And while we are very pleased with the progress we are making with our provincial vaccination rates, one of the things we look at closely are the rates by age groups. And we are seeing a trend in other jurisdictions where COVID outbreaks are occurring in younger populations, which tend to have lower vaccination rates than the older age groups. Early on in the pandemic, older individuals experienced more severe disease as a result of COVID, but we are now seeing severe disease occur in younger ages as well. I cannot overstate the importance of making the choice to be vaccinated, regardless of your age. There is no age group that is more or less safe from COVID. Vaccination is the best way to protect yourself and those around you. And the more of us that are vaccinated, the better chance we have of defeating this virus and returning to a post-COVID life. We need everyone's help now, and every dose counts. As a reminder, even if you are fully vaccinated, you must still adhere to all public health requirements, including masking in public spaces. The special measures orders remain in place, making masks mandatory, and there are no exceptions for those who are vaccinated. As outlined in our reopening plan, we estimate that step 3 may come as early as September 15th, and if we meet our vaccination targets, and we'll review the evidence on masking at that time. As we ease restrictions, we will see new cases of COVID-19. And a central part of living with COVID is preventing new cases from turning into outbreaks. We can only do that if we can find each and every case in time to contain it and prevent the spread. This is where your part comes in. If you have even one symptom of COVID, you must stay home and book a COVID test. This is for everyone's protection. I understand that it can be difficult for parents to keep their children home for what seems like a harmless runny nose, a hallmark of childhood, really. And it may seem innocent to make a quick trip to the corner store or go into the office when you have a mild cough. In the days before COVID, this was acceptable, but it's not so today. We all need to adapt to the new reality we live in and assume that any symptom of COVID could be COVID. So please get tested if you have any symptoms. As a recap for anyone just joining us, there is 1 new case of COVID today, and the number of cases in our province is 1,386. As we embark on this significant transition, we must do all we can to get it right so that we can continue to move through the next steps in the reopening. We all have a responsibility to make this work. So follow public health requirements, stay home and get tested if you are sick, and please make the choice to be vaccinated. And hold fast, Newfoundland and Labrador. Thank you.
Well, thank you, Dr. Fitzgerald. I'll now invite some comments from Minister Haggie, who's at home.
Thank you very much. Speaking to you from sunny Gander. Before I start, Premier, I'd just like to point out that today is Arthrograposis Awareness Day. Each year, for the last 6 years, I've been visited by a young lady called Casey Ebsery, who unfortunately, because of COVID, can't do that this year. I'd just like to take this opportunity to thank her and her mum for the advocacy work they have done on behalf of raising awareness of this condition, and wish them well for a good summer. Our vaccination status across the province is good. We have made way better progress than we had hoped. We've been slowed down by some vaccine delivery issues, which, despite assurances, have restrained us a little. But still, 80% by close of business tomorrow is not shabby at all, and well ahead of where we thought we'd be. So well done, everybody. Dr. Fitzgerald did reference the travel documentation. I'd just like to take the point to repeat this. This is a documentation process. It's not a criteria for determining whether you can come in. It is a document that will help verify your vaccination status and govern, in a sense, your isolation requirements. A comment about international travellers. In the absence of any other instructions from Canada Border Services Agency about to the contrary, international travellers will now follow the same path to isolation or not, depending on their vaccine status, that you would if you came to us from Alberta or Ontario. I'd just like to clue up quickly by saying that Dr. Fitzgerald's comment that every dose matters is really extremely relevant at this moment, and I would encourage everybody to continue to consider vaccination. We've done very well. We, Canada, lead the G7 in vaccination rates, and Newfoundland and Labrador has done as well, if not better than a lot. So every dose matters. Thank you very much, Premier. I'll turn it back to you.
Thank you, Minister. I'll now invite questions from the media. I understand there's some virtual and some here in person.
Thank you, Premier. For the benefit of our speakers, we have 4 media in person and 2 joining by phone. The first round of the question and answer session will give each reporter the opportunity to ask 1 question and 1 follow-up. Following this, there will be a final round where each reporter will have the opportunity to ask 1 final question. Our first questions are from Peter Cowan with CBC. Please go ahead and make your way to the mic.
Question about airport testing. So there's now drive-through testing sites that are set up at many airports across the province, but it's by appointment only. Why is that the approach that's being taken, and especially when flights may change, may get cancelled, may get delayed, rather than just going with a first-come, first-serve based on when people land and when they're able to then go through?
So people, when they put in their vaccination status, if they're put in as partially vaccinated, they will get linked to an ability to book that test. So it is just more about planning. I guess operationally, the RHAs need to know that information to be able to staff and to ensure that they have enough people there to be able to do the testing. They do have contingency plans in place with regard to cancellation of flights or delay of flights and things like that. I can't speak to all of that individually just because it is operational, and I wouldn't know all the details about that. I don't know if, Minister, if you have
There's
any...
also the ability, of course, the pre-departure is something that we should encourage people to avail of as well.
Can you just explain that?
So you can avail of or I don't know if you want to, Dr. Fisher, you can avail of a pre-departure COVID test if you're partially vaccinated, so you don't have to get it on arrival. So as long as it's valid within 72 hours of departure, then certainly for convenience, the traveler can have that done prior to arrival.
And that actually leads well into my next question. So for people who are traveling from here to elsewhere and the place they're going to needs a test, I've heard from folks who've said they can't get it at public health here because you need to have a symptom. Traveling isn't a reason to be able to get a test. So considering we're asking people who are coming in to have a negative test, why isn't there an easy way for people who are going out to be able to get that test before they leave?
Well, there's certainly private options available for people, and if people are booking travel, then we don't cover travel insurance. We don't cover, there's all kinds of things that government doesn't cover with respect to travel for tourism purposes, and this would be no different. There are private options available.
Our next questions are from Peter Jackson with The Telegram. Please go ahead and make your way to the mic.
Hi. This is for the minister, I assume. I just want you to confirm, are you now saying that international travelers can come here as long as they're doubly vaccinated, fully vaccinated, they do not have to self-isolate?
Thank you for the question, Peter. Unless the Canada Border Services Agency has any specific requirements of them to do differently, they simply follow Newfoundland and Labrador's arrangements for travellers entering the province from any destination. So essentially they would, if fully vaccinated, not have any requirements.
Okay, thank you. And I'd like a little bit of clarity on the travel form. You say it's not a a denial or an approval of travel. What is the reason for someone filling this out at all rather than simply going by someone's word?
So we do have...
The issue...
Sorry, go ahead, Minister.
The issue with the form is it is a record of vaccination. It allows vaccine status to be collected independent of sharing information with airport security staff or Garda World or whoever it happens to be. And it also allows us to audit retrospectively. At the very least, we can identify locations of origin, tie them to batch numbers and sources and dates of vaccine supply through federal supply chain. So we do have means at a very superficial level of auditing, and that is part of the function of these forms too. If we find there are a significant number of errors, then we'll obviously look again at the process.
Our next questions are from Kellyanne Roberts with NTV. Please go ahead and make your way to the mic.
Thank you. Premier, you noted to Peter Cowan that for those looking for testing leaving the province, there were private businesses that could do that. So we're saying that the testing sites set up here for appointment only aren't for people looking to leave the province.
That's my understanding right now. It's more reserved for symptomatic testing and screening purposes, correct?
Yes, that's correct.
And just touching on the international travelers, does that apply for international rotational workers as well then looking to come home on their off days?
Yes, so international rotational workers will be treated the same, provided that they have an exemption from the isolation at the federal level, which my understanding is right now they would if they were fully vaccinated. If not, if they were not fully vaccinated, then they would have to follow the rules of that apply from a federal point of view, same as before.
Our next questions are from Patrick Butler with Radio Canada. Please go ahead and make your way to the mic.
I also have a question about these new clinics for travelers. Where are they going to be located, and will the process be the same if you're coming across on the ferry from Marine Atlantic or if you're an airline traveler?
Okay.
Oh, sorry, Janice.
It's okay. I can't see you anymore.
We can't see you this time, Minister. Usually there's a screen where we can see when you're going to weigh in, but...
Well, lucky you. You want to take a chance? No. Okay. From the point of view of location, those are operational decisions from the regional health authorities. My understanding, for example, is that Eastern Health is setting up a drive-through facility. I have not yet seen the details of what Western Health, for example, would do at the ferry, but those will be published as soon as I see them, if Western Health haven't already done that directly, because they sometimes do.
But is it safe to say that at any airport, where you would be getting travelers coming into the province, that there would be an associated testing clinic for travelers in that area?
There will be, certainly, for example, in Gander, there will be one related to the airport here, and Deer Lake Corner Brook will also have an option for local testing. That's been organised in conjunction with the regional health authorities.
We will now go to the phone. Our next questions are from Richard Duggan with VOCM. Please go ahead.
Thank you. With some people expressing concerns over the mixing of vaccines, I've received a few questions about the availability of the Pfizer vaccine. Dr. Haggie, how much Pfizer is the province expecting over the next little while, and how does that compare to the availability of Moderna?
We are going to be blessed with large quantities of Moderna, and unfortunately this week and last week Pfizer had to reduce their supply to the province for reasons which were not clear. So Pfizer is being allocated on the basis of the 12 to 17 group who can only have Pfizer. So the clinics in the regional health authorities will look to see who's booked, and if there are people in that category, Pfizer will be provided. Other than that, it's going to be Moderna really for the next 3 weeks, not exclusively, but by and large, the vast majority will be Moderna.
Okay, and Dr. Fitzgerald, our COVID case numbers are down into the single digits. We're reopening to the rest of Canada tomorrow. Are you concerned about people letting their guards down now as we enter into this next phase?
Thanks, Richard. I'm always concerned about that, not just now. So, I think it's going to be incredibly tempting for us to think that we don't have to worry about it. We're transitioning now from a phase of pandemic to moving into living with COVID and having COVID be a virus that circulates and that, from time to time we may see cases of. As more and more of us are vaccinated, we'll find that COVID will become a much more manageable disease, I'm sure, barring any new variants that may arise. So I think, we still have to be careful. We're trying to be hopeful. We're trying to be optimistic about what's going to happen over the summer and hope that we'll be able to enjoy a good summer as more and more people become vaccinated. I think that's really important. And what we have to remember there is that 2 doses of the vaccine is really effective at reducing severe disease and at reducing spread. So we need to make sure that people get vaccinated with 2 doses of the vaccine. And, but for right now, for the meantime, especially through this phase 1 or step 1 that we're moving through, I think we still have to bear in mind, masking and physical distancing, keeping our contacts low, keeping track of things, just trying as much as possible to, to remember those public health measures and to practice those public health measures. It's not to say that, there won't be a wedding that you go to or something like that, but that, perhaps going to events like that 3 or 4 times in a week would not be, where we'd want people to be thinking about or what we'd want people to be thinking about doing. So, it's really just about trying to maintain some level of adherence to those public health measures, as well as to get out there and get vaccinated. And of course, we're keeping a very close eye on epidemiology. So.
Our next questions are from Roger Bill with iPolitics. Please go ahead.
Premier Fury, I'd like to ask you about the prediction you made in March during the election that by the end of June, every person in the province who wanted to be vaccinated would be. Obviously, you're happy that we're at the 80% of people who are eligible. As I just heard Dr. Hagee say, his target was less than 80%. He's implied that we're overshooting it. What was your target? Were you aiming at something higher?
No, we were still on target. As you recall, we made a calculation back at the time that was based on 1 dose, and we also made a calculation at the time that was based on 12% on a certain percentage of wastage, the population over the age of under the age of 18 not included, and recognizing that was probably about 12% of people who were never going to avail of the vaccine based on our previous experience with influenza vaccines and others. And my rough memory of that was that we calculated that we would need about 379,000 at that point. Stand corrected by a small factor, but seems like we're not only at target, but beyond that target. So it wasn't that the minister and I weren't on the same page at all. In fact, we were quite aligned.
Thanks. Dr. Fitzgerald, assuming the best case scenario where everything goes the way we want it to go, and that some variant of the virus doesn't outsmart the vaccines, when can we start shaking hands again?
I don't know. I think not shaking hands has been working pretty well for us. So, I think we'll be looking at relaxing some of those public health measures as time goes on. But, all of that good personal public health measures to prevent the spread of respiratory viruses should still be our standard practice. So, if you want to be shaking hands, just making sure you're washing your hands frequently and well, or using hand sanitizer. I think that needs to there are some lessons from all of this that we need to continue to use and to take forward. And I think, information about hand sanitizer and using hand sanitizer is one of them. Information about masking is another. And, so just because we feel like we're going to move away from pandemic COVID and into what we call more endemic COVID does not mean that we can just let all of the lessons we learned go away. So, I think we still need to bear in mind some of those lessons.
I will now go back through each reporter to see if you have one final question. Peter Cowan with CBC, do you have a final question?
Yeah, I've got a couple questions. I want to ask about rotational worker outbreak sites. You mentioned that they're no longer going to be treated differently. A couple weeks ago, you said that we've actually received quite a large number of cases from these outbreak sites. So why the change in the way we're treating these workers?
So at the moment, certainly back when we were seeing a lot more cases coming in, we definitely were seeing them from these outbreak sites. But, many of these sites have actually done a really good job at vaccinating workers right now. They've done a really good job at clamping down and getting these outbreaks under control. We're seeing every day, there's more and more outbreaks that are declared over. And there is a lag in that because we usually let 2 incubation periods go by with no new cases before we declare an outbreak over. So there is always a lag. But, so we're certainly not seeing that same kind of importation. We're not seeing that same kind of epidemiology, and the vaccination rates in rotational workers, both here at home and for people who've gotten vaccinated away, has improved significantly. So that's why we made that decision.
Excellent. And I've got one more question I'm hoping you can answer.
Just one final question, Peter. Actually, it's just one final question.
Well, it's just a quick question. We're not going to have a briefing for another 2 weeks, so I'm hoping that Dr. Fitzgerald...
No, we actually have one on the 7th. We do have one on the 7th.
Thank you.
It's about the intervals. We're sticking to 8 weeks. A lot of other provinces have shortened it down to less, especially in light of the Delta variant, which we're seeing circulating a whole lot more, and we know one dose isn't very effective. Are we looking at shortening it further?
So right now, we are maintaining the 8-week interval. It is certainly, there's some evidence to show that lengthening that interval between doses may give us a better immune response, which generally speaking will correlate into better protection. Taking the principles of vaccine science into account as well, we know that a longer interval tends to give a better immunological response to a vaccine. So at the moment, given our epidemiology and given what we know, what we're seeing, we're certainly going to continue with the 8-week interval at this time. That being said, if our epidemiology changes and if we look at some of those other places who are shortening that interval or allowing that interval to go down to 4 weeks, for example, they're seeing more cases of COVID than we are. And so from an epidemiological point of view, it certainly is reasonable that they would want to try to increase the number of double vaccinations. But at the moment, we're going to continue on as we are. And, as we've said from the beginning, if the evidence changes, the epidemiology changes, we have to do something differently, then we will.
Thank you.
Peter Jackson with The Telegram. Do you have a final question?
Yes, I do. Someone, more than one person, in fact, has expressed concern about getting AstraZeneca. People at clinics apparently don't, at least one clinic that I know of, have no idea how someone would actually do that anymore. How would someone get an AstraZeneca, particularly if they have an allergy to the other?
So actually, that's a good question, and my understanding is that if there were AstraZeneca clinics available, however, I think most of those got booked up and the demand really dropped off. But Minister, I don't know if you have any more information on AstraZeneca clinics?
Or the allergy?
Certainly, actually, it's a good question because it speaks to the issue of allergies to vaccine components. Yes. Each of the regional health authorities has set up a particular telephone line. So if you are known to have either anaphylaxis or a significant reaction to a component of a vaccine, then you can ring that line, explain your situation, and an appropriate appointment will be made for a vaccine that is suitable for you if one exists. So that deals with it from the point of view of the allergies rather than the point of view of the vaccine.
Okay, I just wanted some clarity to this. Not another question regarding international travel. Does that include St. Pierre now?
So those discussions are still ongoing with Minister LeBlanc and his counterpart federally. We don't have a decision on that yet.
But it's international travel, isn't it?
With Minister Dominic LeBlanc from the
Yeah, but it's international travel. You say international travelers can now come here with the vaccines.
yeah, no, fair enough. I thought, sorry, your question was surrounding the St. Pierre border.
It is.
Well, we haven't opened, nor is it our jurisdiction to open the border between St. Pierre and Newfoundland and Labrador. That decision lies with the federal government. We have advanced those discussions or suggested advancements on those discussions, but that lies within the federal government purview.
Okay, thank you.
Kellyanne Roberts with NTV. You have a final question?
Yes, thank you. In terms of vaccine passports, we're hearing a lot of people with concerns about traveling internationally, whether it's just the United States or further abroad, about mix and matching vaccines. We know in the States they're only allowing the FDA-approved vaccines right now for certain events, not just to get in. I'm thinking the Springsteen on Broadway, things like that. Is there any opportunity in the future for people who had AstraZeneca, which isn't approved by the FDA yet, to get another mRNA vaccine after their 8 weeks to have at least 2 mRNA vaccines?
I think that's certainly something that we're all looking at. Of course, internationally, everyone is looking at how to solve that riddle. And as vaccines become more available, as they have been, of course, that's something that we'll entertain here as a province, no question.
Patrick Butler with Radio Canada. Do you have a final question?
I do, yeah. Looking at the federal government's forecasted allocations for different vaccines, there's none this week for AstraZeneca. Does that indicate that we won't be receiving any more AstraZeneca vaccines in the future?
Small.
Yeah, I don't think we'll be receiving much AstraZeneca. The demand has dropped significantly, so and we still have AstraZeneca on hand here. So,
Richard Duggan with BOCN. Do you have a final question?
Yes, another question about AstraZeneca, actually. Health Canada is updating the label for AstraZeneca to add capillary leak syndrome as a potential side effect, and the agency is also warning those with a history of that disease not to get AstraZeneca. Dr. Fitzgerald, what should people know about that side effect and its prevalence?
Yeah, so it's certainly a very rare side effect. It's been described in a few cases, so the significance of the signal is still, under investigation. Health Canada, I think, updated the monograph to reflect that for people to watch out for. Certainly symptoms of swelling in arms, legs, and it's an inflammatory reaction in general, and it can happen for a lot of other reasons other than getting this vaccine. So it's certainly, if there's any concerns regarding that, we're certainly encouraging people to talk to their healthcare practitioners and anyone who has a diagnosis of that or has had a diagnosis of that in the past to certainly have a discussion, and it wouldn't be recommended that they get that AstraZeneca vaccine.
Roger Bill with iPolitics. Do you have a final question?
Premier Fury, thanks for kind of explaining the way you calculate the target back in March. So if I understand it right, you expected that 88% of people who were eligible to be vaccinated would be. We got to 80% by the end of June. Given the uncertainty in March about the delivery of vaccines, I think nobody's going to fault you and the minister for taking a victory lap. It's a achievement. But I want to ask you just a last question about politics. Do you think if you'd waited until now to call the election, till after the outbreak was more contained and life was returning to normal, that you think you might have had a better chance at winning a more substantial majority of seats?
Look, revisionist history is always perfect, and the rearview mirror is always perfect. I made the decision, as I've maintained the whole time, Roger, as you know, with the best evidence that I had available at the time. There was, as you recall, it's tough to remember where we were then, but there wasn't a robust supply of vaccine. The vaccine was fairly new at that point, the vaccines. In fact, they weren't all even approved, and there was some question about supply chain. So you make the decisions with the best evidence that you have real time. we'd all love the benefit of the hindsight and be able to revision at times, but that's just not life. So we made the decision with the best evidence available, and quite happy with my majority. Wish the outbreak didn't happen. That's a stochastic event, but such is life, and we move on.
Thank you.
Thank you, everyone. The next COVID-19 briefing will be on Wednesday, July 7th. Premier, do you have any final comments for today?
Thank you all for joining us. It's a big day tomorrow, and if you are celebrating with loved ones that you haven't seen for a while from across the country, please enjoy, be safe. We'd also like to, again, thank all the hardworking women and men from all professions in those vaccine clinics who have allowed us to reach this incredible goal. I think that we all would realize that this was an incredible target to set, and now that we've met it, I think we all we can't breathe a sigh of relief, but we can certainly enjoy the embrace of loved ones from across the country. And so please do so. Please do so safely and responsibly, and continue to do your part in combating COVID-19. And so, to echo Dr. Fitzgerald, every dose counts. So if you haven't had your dose, please book your vaccine.
Thank you, Premier. Stay safe, everyone. Take care of yourselves and each other, and enjoy the rest of your day.
This is Jan. Jan sometimes visits her neighbor Paul. Paul has COVID-19, but doesn't know it. Jan also takes the bus. So does Mo, who's a frontline worker. So if Paul infected Jan, Jan could infect Mo, who could infect a lot of people. But wait, they all have the COVID Alert app. So Paul tested positive and entered a code in his app, which anonymously alerted Jan. So Jan stayed home and Mo went to work safely. Phew, close call. Help break the chain of infection. A message from the Government of Canada.
Of the preceding program, we now join the regularly scheduled program already in progress.
My old shag rock. We'd ride our bikes through